Hi, everybody. This is chapter 31. This is drug therapy for the male reproductive problems, and this is on page 481 that it starts off. So we're going to talk about a few things. Um, Men over the age of 50 do have BPH, are more prone to having BPH, which is benign prostatic hyperplasia, which is also called an enlarged prostate gland. Prostate um, Enlarged one, what happens is it will squeeze the urethra, and if it does squeeze the urethra, that will cause decreased urine flow, which can cause a buildup of urine in the bladder and cause a lot of pain and issues for the individual. Um, so that is something that we have to be concerned about. That's why when we always talk about urinary retention, drugs, anything that causes that issues, we're concerned about these patients because they're holding on to urine as it is, and it can cause more issues because what usually occurs is they're getting up to pee more frequently. They're not releasing all the urine at once. So that's an issue. BPH and prostate cancer have the same symptoms. So you need to be seen in order to rule out to make sure it's not cancer, and that's very important. It's very important to have your yearly, male population to have their yearly prostate exams and make sure that they have cancer screening done because the signs and symptoms are the same. And you won't know if it's BPH or if it's cancer. So that's why it's very important to have yearly prostate cancer exams um, to make sure everything's okay. BPH, for individuals who do have BPH, it will increase their risk for urinary tract infections because they're not getting rid of the urine. Bladder can become blocked, which can cause a lot of issues. Urine backing up into the ureters as well as into the kidneys. And if it goes back into the kidneys, it can lead to kidney damage and failure. So that's why it's very important to make sure we maintain and get these patients taken care of. Um, can have If they have severe issues, then they can do surgery on these patients. They can have mild to moderate issues. A lot of times they will give some drugs to see if that will help with that. So the type of drugs for BPH, there's a couple out there. We have the DHT inhibitors, and we have the selective alpha 1 blockers. So those are the ones that we're going to be talking about. So on page 483, are common BPH drugs. And finasteride or Proscar is probably the biggest one that we give out there. And I've also give Tamsulosin or Flomax is another one. That is a big one that we give out there. And we've given Terazosin, which is Hydrin. Those are probably the biggest ones that I have given. So, and I always remember some of them like finasteride. I can remember Proscar because prostate pro. And then like Raptaflow, the Silodosin, which is Raptaflow, the flow of urine. Tamsulosin, Flomax, the flow of the urine. So those are some ways that I can remember some of those medications. But of course, you have to know the generic. But try to learn both of them because a lot of times you'll see one or the other. All right, so the intended response of these, of course, that's going to be on page 483. They will decrease pressure on the urethra, which is good. Hopefully, we will improve the urine flow, and we're going to have decreased symptoms. So that's what we're looking for. Now, side effects. Now, the biggest side effect, and a lot of times patients who have these medications will stop it because it will decrease your libido. And that is the major common side effect is decreased libido. Some more specific ones is DHT inhibitors can cause some erectile dysfunction, which is called ED. It will decrease the seminal fluid and it will reduce fertility. Also, another thing it will slow hair loss and some hair regrowth. So we'll actually slow hair loss and some hair regrowth. So that's a positive thing. It will slow hair loss and actually cause some hair regrowth. So that's with our DHT. Now, our selective alpha 1 blockers, these ones will decrease your blood pressure. So it can cause orthostatic hypotension. It can cause dizziness or lightheadedness. Can cause back pain, runny, or stuffy nose. So those are some of the side effects that occur with the selective alpha 1 blockers. Now, your adverse effects, liver issues. These drugs metabolize by the liver, and it can cause an increased drug in the level, leading to more side effects and adverse effects. So if you do have any liver problems, you may want to be given at a lower dose. If you have big time liver problems, BPH meds are probably not the drug of choice for you because they can cause a lot of liver problems. DHT inhibitors for adverse effects can cause breast changes. So in the male population, it can cause enlargement. It can actually cause lumps. You can have painful breast. You can actually have fluids leaking from your nipples. You can get pain in your testicles. So you want to make sure you report this immediately because usually if these things occur, they will stop the drug. So you need to hold the dose and notify the doctor right away if you have any of those issues. Your DHT inhibitors, if pregnant or becoming pregnant, you should not ever, ever, ever touch this pill. Men taking it should use a condom if the female is pregnant or may become pregnant to prevent birth defects because these medications will cause big time birth defects. That's why if you're dispensing any of these DHT drugs, you need to make sure that you wear gloves. If you're in the female population and you are going to or possibly are pregnant because it will soak through the skin and cause birth defects. And a lot of times you'll see on the wrapper that you have to wear gloves, especially if you're taking finasteride or Proscar. That is probably the biggest one that I've seen. Now we do use dulasteride or Avodart, but like I said, the biggest one that we do give is the one. Now your alpha-1 blockers are excreted by the kidneys. So if you have renal problems, it can retain longer and cause severe hypotension. Not toxic to kidneys. It shouldn't be prescribed to patients with kidney problems. So we do need to watch for that. Tamsulosin or Flomax, you can't take if you're allergic to sulfa drugs because it is made from some sulfonamides. Okay, so Tamsulosin, Flomax, if you're allergic to sulfa, you can't take it. An allergy to sulfa, you cannot take Tamsulosin or Flomax. That's important. Your alpha-1 blockers interact with many drugs, that's over-the-counters or herbals, antihypertensives, cardiac drugs, and drugs for erectile dysfunction. So it's very important to make sure that we get a full list of all the medications they're taking. And another thing is alpha-1 blockers will cause floppy iris syndrome. And that is usually happens during cataract surgery. The iris won't respond to the meds that constrict or dilate the eyes, which can cause iris to collapse towards the surgical site. So it's very important to tell this surgeon that, or before the surgery, that you're on these medications so they can take steps to prevent this from happening. So that only occurs when you're on the alpha-1 blockers and you're getting any type of cataract surgery. So before we give these meds, you need a digital rectal exam and lab work for your PSA, which is a prostate-specific antigen. That's lab work to rule out if you have prostate cancer before these meds are prescribed, okay? Because it's going to tell you, are they for if it's a cancer or if it's prostate. So you need to have that done beforehand, and you should be checked yearly. Check liver function because we know these meds will increase the levels of the drug. We want to make sure we do a set of orthostatic blood pressures because we know the alpha-1 blockers can cause this problem. And if they're allergic to sulfa, then they should not be prescribed Tamsulosin or Flomax. Afterwards, we're going to recheck the orthostatic hypotension, especially after the first dose. And we're going to make sure safety concerns are a big thing. We're going to teach our patients annual prevention and early detective practices to make sure they get checked yearly. DHT inhibitors, we also kind of remember, women cannot touch the pill. If you're pregnant or going to become pregnant, and men should wear condoms with these females because it can cause birth defects. Men should not donate blood because if a pregnant woman could get that blood, it could cause birth defects if she's pregnant or planning to become pregnant. So they cannot donate blood if they're on any DHT inhibitors. Herbal preparations, there are herbal preparations out there like saw palmetto and soy isoflavones. They have some action as DHT inhibitors and can increase the response of the drug, which can lead to a lot of side effects. So that's why it's very important to know any herbals that they're on. Alpha-1 blockers change position slowly. It usually happens when the patients first take the drug. Usually they're dehydrated or they have hypertensive meds. Erectile dysfunction meds, cardiac drugs, which are like beta blockers or calcium channel blockers. Safety is going to be a big concern, so we have to watch with that. Alpha-1 blockers, inform the eye doctor if you're taking before cataract surgery because it can cause that floppy iris syndrome. So we need to check that. Alpha-1 blockers interact with many drugs prescribed and over-the-counter meds, so check before taking. You want to make sure we have a full list of their meds. And DHT drugs. DHT drugs can take 3 to 6 months. DHT drugs can take 3 to 6 months before you will start seeing some improvement. Okay, you will not see improvement. It can take up to 3 to 6 months to start working, so that's not uncommon. It's not recommended for the pediatric population. We don't really see that much often, but it's not recommended. Of course, pregnant breastfeeding, we can't handle the DHT inhibitors because of the birth defects. And meds are used for the males, not the females. In our older population, those are the ones that are at higher risk for prostate cancer. They need those annual checks. And they're at risk for orthostatic hypotension, especially if on the alpha-1 blockers. So monitor and safety issues are going to be a big concern. So that is when we're dealing with BPH. Now, when we're talking about male hormone replacement therapy, that's another story. Now, testosterone levels start to decrease around the age of 30. Okay, on page 485, there are causes of low testosterone levels that you can look at, and so that's something to make sure look at, as well as there's some signs and symptoms above it of what happens when you have insufficient testosterone. And then on page 486, of course, there's methods of testosterone replacement. And of course, we have the dosage of our things. And like I said, testosterone can come in patches. A lot of times it can come in injections, so sub-Qs. So there's different ways of giving testosterone. So those are what we're looking at. These drugs promote growth and development of sexual organs. They are a Schedule III drug because you become dependent on the medication, so it's a Schedule III drug. Oral tabs can cause a lot of liver damage, so they're used less often. You're going to mostly see them use patches or injections, but the oral tablets are very rare to use. Like I said, it becomes more dependent on, damage on the liver. So on page 486, I told you those are the common ones that we do use. Their intended response, they will increase muscle mass and bone density. So that's the anabolic effects. Androgenic effects, they can cause mature sex organs. They can cause secondary sex characteristics like growth of hair in the axillary, pubic area, can cause deeper voices. They will decrease symptoms and increase actually sex drive. So those are some things that we're expected from male hormone therapy. But they do cause a lot of side effects. Acne, oily skin, you can have some mild fluid retention. It will increase your prostate size, which can lead to problems urinating. It can cause breast enlargement, sleep apnea. It actually decreases your testicular size. If you give it injections, of course, you can have pain and inflammation at the site. And if you give patches, it can cause itching, redness, or even skin irritation. You can get that at the site where you put the patch. Adverse effects, of course, is liver damage. You can have hepatitis, neoplasms, and cancer of the liver. It puts you at risk for myocardial infarcts as well as strokes. So you do have to watch for heart attacks and strokes with these. So before we give these meds, we're going to ask if they had any prostate or breast cancer. And if they say yes, then they should not get this medication at all. They cannot take any of these hormone replacements if they have a history of prostate or breast cancer. Definitely, they need annual checks. Very important to keep teaching them. Check yearly, sometimes more often if anything is checked out. Get your get your levels checked. Make sure everything's okay. History of diabetes, kidney, liver, or cardiovascular disease, we need to make sure we monitor that, especially since a lot of these cause liver problems, can cause, lot of strokes and heart attacks, so we want to make sure everything's okay. Testosterone can decrease blood glucose levels, so we're going to monitor our diabetics' blood sugars more frequently, and baseline weight and blood pressure, because we know that it can cause a lot of retention, fluid retention. So that's why we have to make sure we check our weight. Labs, we're going to check CBC. We're going to check our liver functions, electrolytes, and cholesterol levels. What are we going to do after? We're going to check weight daily because of the fluid retention, and report if a weight gain of more than 5 pounds to the doctor. So we are going to check weight daily because that could be fluid retention, or report a weight gain of 5 or more pounds to the doctor. We're going to check blood pressure 2 times a day. We're going to monitor the lab test. We're going to check in the injection site. We're going to ask about sleep patterns. We're going to make sure diet contains enough protein and calories. We're going to teach our patients, check your weight daily at the same time, same amount of clothes, and report 5 pounds gained or more in 1 week. Report frequent erections, problems urinating, or breast enlargement. They need a very, very high protein diet while they're on this. It can cause some GI discomfort, so eat small, frequent meals. Report if taking any other drug, and follow a blood test. If they're on the gels or patches, teach family to not touch patient's skin, linens, or clothes that drug had come in contact with. So if they're on any of the gels or patches, teach family not to touch the skin, linens, or clothes that the drug had contact with, because it can absorb through your skin. Pediatric population we use with caution, but we do use it. Sometimes they'll use a lot of the patches. Pregnant breastfeeding population, high risk for birth defects. Older population, increased risk of BPH or prostate cancer. That's why it's important to check those lab values, especially that PSA, that prostate lab, and to have your annual checks. So that's when we're dealing with hormones. And when we're dealing with ED, or erectile dysfunction, which is impotence, this is when a man is unable to maintain or achieve an erection, which can be very detrimental to the male population. It's usually affected at the age of 40 or older in our older population. Causes can be organic, so it can be due to cardiovascular disease, diabetes. A lot of drug side effects can cause impotence. Alcohol use, smoking, if you've had any pelvic surgery or trauma, any neurological diseases, obesity, radiation of the pelvis, decreased hormone levels or production. So those are a lot of things that can cause it. Now, causes that are functional could be psychological, which could be due to depression, anxiety, stress in your life can cause it. So those are some issues. So there's a lot of different treatments that they can use for this. They can do penile pumps, they can do penile implants, they can do some surgery, you can do some psychological counseling, or we can do some drugs like the phosphodiesterase 5, which is our PDE5 drugs. A man can have an erection. What happens is the blood fills the tissue in the penis, causing it to get enlarged and stiff. So that's the occurrence of it. Our PDE5 drugs will relax that smooth muscle, which allows the penis to fill with the blood, and that's what we want. If you fill it with blood, that's where we get it to get hard and stiff. These drugs need sexual stimulation now to cause an erection, and that's important. You need sexual stimulation in order to cause an erection, and it works within 20 to 30 minutes to an hour. So 20 to 30 minutes to an hour. Sildenafil, and these are all on page, let me see. Your 3 major things are 488, okay? So sildenafil or Viagra, you have vardenafil, which is Levitra. Those can last up to 4 hours. Now your tadalafil or Cialis can last up to 36 hours. So those are the 3 drugs that we're going to talk about. So sildenafil or Viagra, or vardenafil, which is Levitra, lasts up to 4 hours. Tadalafil with Cialis can last up to 36 hours. We also use these drugs for the treatment of pulmonary artery hypertension and some forms of pulmonary fibrosis, because it will increase the blood flow in the lungs. So sometimes you will see these medications given to people with pulmonary problems. And that's something that, because it will help increase the blood flow. The intended response for these medications is you need to be able to have an erection. You want to maintain an erection, and you want to increase your interest in sexual intercourse, and that is the main goal of these medications. But they do have some side effects that you have to be careful of. They can cause some GI discomfort, like acid reflux, heartburn, indigestion, diarrhea. It can cause some nasal congestion, skin flushing, um, bloody nose, headache, and muscle aches. Less common, you'll see visual changes, hearing changes, and postural hypotension. Adverse effects, prolonged erection lasting more than 4 hours. Priapism, which is a painful erection lasting more than 6 hours. If this occurs, if you have a painful erection that's lasting for more than 6 hours, you need to see a doctor ASAP. And usually what they'll do when you get there, if there are some medications that actually can cause the priapism. But what they usually will do is, because what happens is the blood, once it gets into the penis, starts clotting off, and they can't go back down because it's engorged with this clotted blood. A lot of times what they have to do is take a syringe and put it in that vein and pull the blood out. So it's not very pleasant for the individual. But like I said, some medications cause it, and then of course these are, side effects if the blood doesn't get moved out. So that's an issue with adverse effect. Tadalafil, which is Cialis, can cause nephrotoxicity, neurotoxicity, or pleural effusions. You want to make sure if you take any of these meds with nitrate drugs, and we know nitrate drugs decrease your blood pressure. It can actually cause angina or angina, depending on how you like to say it. Can cause chest pain or myocardial infarcts, which is a heart attack. And a lot of times we see people who are taking these medications with a nitrate come in because they actually had a heart attack. It also drops their blood pressure. They can pass out too. So before we give these meds, we want to ask if they have any cardiovascular disease or any BPH. We're going to check their liver and kidney functions. So we're going to do some lab work. We're going to report if they're on any nitrates, because we know it can cause severe hypotension and that can make them pass out. We want baseline vital signs, a current list of their medications, and nitrates can cause extreme hypotension, so they have to monitor their blood pressure. Guess what? St. John's wort, no, because it can decrease the concentration of the drug, so no St. John's wort. And if they're on alpha adrenergic blockers, it can cause hypotension also. So what are we going to do? We're going to monitor the vital signs. Any visual or hearing changes, we're going to report any side effects or adverse effects, any prolonged or painful erection lasting more than 6 hours. We're going to give Tylenol if they're complaining of a headache. We're going to teach the patients, if you're taking these meds, you need sexual stimulation for these drugs to work. Without it, you may have a thing, but you need some sexual stimulation. Report if erection lasts longer than 4 hours or prolonged painful erection more than 6. Notify the doctor. Report loss of vision or hearing. Take 30 minutes to 1 hour before the sexual activity. So you know to take it beforehand. Avoid nitrate drugs because it will decrease blood pressure. Monitor blood pressure and heart rate. Avoid alcohol because it will increase your risk of orthostatic hypotension. And guess what? No grapefruit or grapefruit juice because it will increase the drug concentration. High-fat meals delay maximum effectiveness of the drug, so you don't want to have a high fatty meal beforehand. And safety precautions, get up slowly because it can cause a lot of issues. So there's just some issues that deal with the male population, and that ends chapter 31. So any questions, give me a ring.